When you're in direct patient care, you have to be very, very careful. If you're worried that you were exposed to a patient and you're not adequately protected with personal protective equipment, that gets into a strict gray area. But the data that we have from the Cough and Fever Clinic running some new antibody tests, which we now have online, we tested the healthcare workers that were exposed to COVID-19 patients first to kind of test to see whether the lab works. And the good news that came out of that, which was published on the Hattiesburg Clinic's website on a white paper by Dr. Batson and Tommy Thornton, is that the healthcare workers that were properly wearing PPE, none of them seemingly got ill as a result of exposure to known COVID-19 patients. So the first thing is, as a healthcare worker, you have to assess whether you had the appropriate PPE. And if you did, the chances are you're going to be okay. And then you don't need to wear a mask around your family. But when I come home to my family, know that I am their only major exposure because they're essentially staying at home. So the precautions I take before I go home include taking off my shoes in the garage and leaving them there, so those shoes never come back inside. I'm wearing scrubs, so as soon as I get home, before anybody touches me, I go and throw the scrubs in the laundry, and then I go and wash up, and then I can interact with my family.